The public has always feared medical or dental x-rays. And the media is not helping either. Lately, there's been a lot of media, negative media about dental x-rays, and from time and time again, I'll get patients, and it's a common occurrence in many dental offices, patients declining x-rays for the sole reason of what they're hearing or reading in the media. I don't know what the fuss is all about. Let me go over a few things. Did you know that when we just stand outside in the sun, we're exposed to radiation? Let me just draw a diagram on my tablet. So basically, if we have, here's our ground, and here we are standing outside. So you can see, there you are, you're standing outside, and let's switch the color here. Let's do the sun. Don't have yellow, but we'll do a green sun up here. So there's our sun. And just standing outside, we're getting rays coming down from the sun. So I'll draw the rays in red. There we go. So you see all the rays coming from the sun? This is called solar radiation, or even background radiation. We are all exposed to this when we're walking outside. So basically, if you compare regular bite wing x-rays that you have done when you go for your checkup, those x-rays, we're exposed to less radiation than one full day of standing out in the sun. So if we were to compare that one time a year that you're having those checkup x-rays, is, one full year you're getting 365 times the amount of radiation greater than what you would get from just a couple bite wing x-rays. So, and in this day and age, with the advent of the digital radiography and all the new faster films, and the new techniques in dental offices, the new x-ray machines, the radiation is so minimal, next to negligible, compared to when you're standing outside and you're being exposed to the radiation just from being outside. In addition to that, x-rays are very, very important in the dental practice. We need to take them for your overall dental health. Do you expect, we dentists are not magicians. You can't expect that when we take a look in your mouth that we're going to be able to identify everything and with confidence, and to let you know that, okay, there's no problems, no cavities. We can't work in the dark. And these are an excellent way for us to help you at the end attain better oral health. We can detect many things, and it makes it easier. Let me come to another diagram. Now, basically, if you're looking at our teeth, so here's one tooth, and then there's another tooth, a molar and a premolar. And they join, they touch at a point, and in between that point, that is where we would floss. That is the flossing area. So when we get in and floss, we can get cavities. Let me just switch. So we can get cavities right in between in the flossing area. These cavities are not visible at all. They're very hard to see when you're just looking in the mouth. What will help to show these cavities would be a dental x-ray or a bite wing x-ray. A bite wing x-ray will help us to detect these cavities, so we can get in and we can treat these cavities early before they become a big problem. In addition to cavities, that I would call them even flossing cavities because they're in the flossing area. Another great occurrence these days, which we're hearing day in and day out, which the media doesn't really touch on the positive aspects of what is used to detect these lesions, but there's many lesions in the mouth, many tumors and oral cancers, which can only be detected by using a scan or an X-ray. There are lesions that are present in our jaw bones and in our sinus areas, and that's why it's all in all very, very important at the end of the day for your total oral health. So when you go see your dentist, it's not like we're not there to put you through this added risk. We're here actually to help you, and at the end of the day, we want your overall oral health to be at its best, and for us to be able to detect a problem early on in the stage before it becomes a big problem.